What HealthTalk has done for us from a financial perspective, the ROI is almost unimaginable. We've decreased unnecessary ER visits. We've shortened lengths of stay. We've attracted patients to our system that now will not leave. I'm Joe Monsour. I'm the CEO of Allegiance Healthcare. We're a Louisiana-based healthcare system. We operate primarily in the rural space, which is the patient population that probably needs healthcare close to home more so than anybody. So our drive is to create quality care close to home, whether it's pre-hospital, hospital, post-hospital, or even end of life. How I was introduced to HealthTalk A.I. was in an effort to find ways to close the gaps on healthcare for those patients in that geography and that population, whether it's a Medicaid member or it's a Medicare or a commercial patient. And what HealthTalk has enabled us to do is to micro-target groups of patients that had not had access to care in the past, whether it's for a wellness visit and they have not seen their primary care provider in ever or in the last 24 months. We're able to micro-target those groups and get them access to the care. Mammography, colonoscopy, specialty care for orthopedics, neurology, all of the things that people historically thought they had to go to the big city to follow the shiny light to get that kind of care. We're bringing all that care back to home, and HealthTalk AI has afforded us the ability to contact those patients, communicate with those patients, and automate their access to care, which has eliminated the need to fill employee gaps that are almost impossible, decrease human error, and at the end of the day, make Louisiana a healthier state. Typically, we don't look at things as financial gain. However, that's how we stay solvent. So what HealthTalk has done for us from a financial perspective, the ROI is almost unimaginable. We're seeing patients that we would not have seen before. We're creating risk scores on them through the wellness visits that enable us to give them the proper level of care throughout the continuum over a period of time. So not only are we capturing those visits, but we're also decreasing the leakage and the outward migration of those patients that are attributed to our system into other markets. We've decreased unnecessary ER visits. We've shortened lengths of stay. We've attracted patients to our system that now will not leave. And so their families, the mothers, the children, the dads, the uncles, they're getting, again, as I said earlier, quality care close to home, and we're able to attract them and keep them utilizing HealthTalk AI. If you look at Louisiana historically, Louisiana is ranked 50 out of 50 in healthcare, and that's not the top, it's the bottom. We want to raise Louisiana out of the bottom, and the patients that have not seen their primary care provider are the most expensive patients to the state and to the federal government, and they're the least healthy. By proactively targeting them utilizing HealthTalk AI, we're not only able to save federal and state money by decreasing the expense of taking care of that patient, we're giving them a healthier life. And those patients are who are going to make our state a healthier state. I think that being a healthcare provider is a huge driver behind Jared's mission, which hits home for us. My partner is a nurse. Most of our CEOs of our facilities are nurses. My mother's a nurse. I went to nursing school, but I decided I like finance more than patients and doctors, and here I am in healthcare. But I think that at the core, that's in somebody's DNA to take care of patients, and the fact that Jared and his team are smart and utilize today's technology to do so, that's where we are as a country. If I were to try to summarize the relationship with HealthTalk AI, excuse me, and how it has been working with those guys, it has been extremely personable. They have been part of our team, part of our family. We're a small Louisiana operation in comparison to the national footprint. But at the same time, we're fairly complex, and they were able to come in and integrate themselves into our team and to be part of our team and see our goal, see our vision, and actively attack it with us.